I have never seen such a horrific medical product in my life.
So it's kind of like a weird alien getting into our system and then keeps doing whatever it does.
The most intelligent people weren't necessarily the people that were understanding the situation and not taking the COVID vaccine. There has been a deliberate suppression by government bodies around the world, fueled by pharma, fueled by ideology, fueled by groupthink, fueled by willful blindness, fueled by fear, to highlight just how bad this situation is.
So what's up with this cholesterol myth? In the new era of health, the way that you guys look at it is different. Can you explain this a little bit?
If anyone comes away from this podcast, the most important message from them, they should understand, is medicine is not an exact science, not even close, not like physics or chemistry. The father of the evidence-based medicine movement, David Sackett, said 50% of what you learn in medical school will turn out to be either outdated or dead wrong within 5 years of your graduation. The trouble is nobody can tell you which half.
I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 19 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome to Soberhead Podcast. Today, I'm joined by Dr. Aseem Malhotra, globally recognized cardiologist and one of the strongest voices calling for ethical, transparent medicine. In this episode, we go straight into two of the most controversial topics in modern health, statins and the COVID-era mRNA vaccines. Dr. Malhotra explains why he believes many people are prescribed statins without being clearly told the real absolute benefit. Then we pivot to the vaccine story. What made him shift from default trust to public opposition, how he describes the risk-benefit conversation that never happened. We also talked about what people can control right now, diet, stress, vitamin D, and recovery strategies. Let's begin. This episode of Soberhead Podcast is brought to you with the support of Gedik Foundation for Education. For over 30 years, Gedik Foundation has been providing opportunities for youngsters, children, and women to realize their dreams through scholarships, projects, and social work. And we're proud to be on this journey together. Investing in education is investment in the future. Subscribe and support us in our quest to bring you the most current scientific data and continue your access to the world-renowned experts in their fields as guests on Soberhead, with Turkish translation and completely free of charge. Comment on the episodes, like and share. Kadın bedeni yıllarca erkek verileriyle anlatıldı. Beslenme de öyle, fitness de öyle, beyin sağlığı da. İşte Longevilab Women's Summit tam olarak bu yüzden var.
Esra Çavuşoğlu'nun ev sahipliğinde dünyanın önde gelen uzmanları kadın biyolojisini merkeze alan son bilimsel gelişmeleri İstanbul'a getiriyor.
Bu bir konferans değil, artık netlik isteyen kadınlar için yaratılmış güvenli bir alan.
11 Nisan 2026, The Grand Tarabi Otel'de gerçekleşecek Türkiye'nin ilk ve tek kadın longevity zirvesi için avantajlı biletler ön satışta.
Bedenimde olanları bilmek ve buna uygun yaşamak istiyorum diyorsan, Longevilab Women's Summit'te bize katıl. Dr. Aseem Malhotra, welcome to Soberhead Podcast. It's an honor, and I know that you're so super busy. You are a globally recognized cardiologist that is doing diagnosis, preventing, and managing heart disease. Around the time of COVID pandemic, you started challenging health authorities and stating that we're in a pandemic of misinformation for statins and mRNA vaccines, and you argue for both are driven by profit, not health. You are an advisor to the American government MAHA movement, Make America Healthy Again. You're also an medical advisor to MEHA, Make Europe Healthy Again. And you're the strongest voice, actually, that I see globally. You had this call out for, this vaccine has to stop. And you also are having strong arguments about statins. So these are both very important issues because, Dr. Malhotra, I experienced injuries from kind of both. One I didn't get into. I had a high LDL cholesterol, and any cardiologist around me, normal ones, says that you have to take statins. Thank God that I have really skilled doctors from America. So I didn't. When it comes to the vaccine, I was living in New York when COVID started, and I thought that I was very privileged as a healthcare worker to have the vaccine, and I ran to have it. Then when I started 2 years ago, this podcast, and when I started hanging out with Mindy Pels and Dr. Yurt and so on and so forth, and I heard that nobody did the vaccine, and I was like, oh my God, what's going on? And then up until I am having this interview with you, I had very esteemed guests. Some of them, you know, Sabine Hazan, Robin Rose, and so on and so forth. All of these people started sharing the injury coming after the vaccine. And you were the loudest voice. What happened? What made you change your mind so strongly, and you became so brave at a point to be almost pushed out from the medical field in England? Welcome again.
Thank you, Ezra. It's a great question. I think first and foremost, for me personally, the reason I went on this journey, and I'll give you a bit more detail, or was able to speak out, or maybe louder than others, is that for me, it comes down to ethical medical practice. I'm obsessed with that. I've been somebody that has been a public health advocate for, probably a good 15 years or so. And I'm aware of structural failures in the system that stop people achieving their best health. And if we define health according to the World Health Organization, it's a state of complete mental, physical, and social well-being, not merely the absence of disease or infirmity. So even prior to the rollout of the so-called COVID vaccine, in my lectures, I describe a pandemic of misinformed doctors and misinformed and unwittingly harmed patients because of a number of factors. Biased funding of research. That's research that's funded because it's likely to be profitable, not beneficial for patients. Biased reporting in medical journals. Biased reporting in the media. Biased patient pamphlets. Defensive medicine. And an inability of doctors to understand, this is relevant, and then communicate health statistics. So these have been my areas for many years to try and break down data, looking at what is reliable, what has got bias, what is funded by pharma. And then even that data, is it then conveyed to patients in a way that is honest and ethical in a way they can understand? So just before I talk about the COVID vaccine, if you give it one example, which most people who are listening will be able to appreciate, I think, or will give them an idea of what I'm talking about. If you look at statins, okay, this is one of the most prescribed drugs in the history of medicine, estimated to be prescribed to between 200 million and 1 billion people globally. Most people who are taking statins will get no benefit whatsoever, and they're not even told that. So, for example, if you are at low risk of heart disease, if you haven't had a heart attack, for example, then your benefit of a statin over a 5-year period from drug industry sponsored trials, and this is crucial, which have never really been independently analyzed. Okay. When drug trials are conducted, they design the trials, they control the data, often the data from a randomized controlled trial, which is a gold standard type of study for evidence-based medicine. Often those trials are tens of thousands of pages long. They give the summary results to the regulators. Unfortunately, the regulators get most of their money from all around the world from pharma now. And then the regulator decides to approve or not approve the drug. So it starts really from the beginning. But when you break the data down, even from those trials, which are biased to exaggerate or give you the best possible scenario of the drug, the benefit of a statin, Ezra, over a 5-year period is 1% at best. So that means if you take the statin drug religiously, there's a 1 in 100 chance it will prevent you having a heart attack or stroke, but without prolonging your life. And this information is not given to patients. Now, this isn't my view. This is actually considered part of what should be, the ethical standard of evidence-based medicine. And the reason people say, well, why does my doctor not know this? Why is my doctor not telling me this? It's twofold. One, we are not conditioned or trained to speak to patients in this way. And two, if patients are fully informed, they choose less treatment. And that isn't very good for the profits of the drug companies. Remember, the drug companies are there to make profit only. They're not there to give you the best treatment. That's their legal obligation. So it's a problem with the law and the economic system that we live in. Okay. Now, coming to the COVID vaccine, despite the fact that I was probably one of the most vocal advocates for calling out the excesses and manipulations of big pharma going back, at least 10, 15 years. That doesn't mean that every medical intervention is bad, okay? And some obviously are going to be worse than others and some less beneficial than others. For me, certainly up until that point, I would put all vaccines, okay, in the same category as safe and effective. I wouldn't have even questioned there was a problem. Part of that reason as well is that a lot of what's informed my practice and advocacy, Esra, has been what I've experienced with my own patients. So statin side effects are something that are much more prevalent that was in the published literature. And I would notice my patients being diagnosing them with statin side effects much more frequently than what we were told was the frequency of the side effects. Maybe, I was seeing it in maybe 1 in 5 patients, and the published literature saying it's only 1% of people. So that's how I started to investigate it. But with vaccines, I've never come across a vaccine injury. I've never heard of a vaccine injury, really. And plus, I'm a cardiologist, so that may not be something, and I've had so many vaccines myself. So you put it all together, I was skeptical about the efficacy, but I wasn't concerned about any side effects or an issue. And then you fast forward the situation where, actually 2020 as well, to add into that, I had some great skepticism about, and I told many people about this even before I had my own complete revelation of the COVID vaccine, which actually is a gene technology. It's not, as you know, it's not a traditional vaccine. It's very different. I was in the UK, certainly, and that became a global story. I published and wrote about the fact that essentially if you're healthy and you're under 70, then your risk from COVID is extremely small. In fact, when we look back, certainly by the end of 2020, John Ioannidis and Jay Bhattacharya analyzed this, and they basically concluded that, the infection fatality rate from COVID was, if you're under 70, was about 1 in 2,000. Now, the overall infection fatality rate from the flu is 1 in 1,000. So you can see that you can make the case that, and of course there are nuances here because I know people have suffered from COVID. I'm not undermining the devastating effects for COVID in some people, even young people. But on the population level, it was very, very mild for under 70s. And that stage was a guy in my early 40s. I'm a healthcare worker. I'm seeing patients, and often we take vaccines to prevent, spreading infection or getting infection spreading to our patients. So that was part of the reason I would have taken it, especially if I'm working with people who are elderly. The other reason I took it as well is, and people listening can probably understand this, there was a state of fear that was created, okay, that influenced people's decision-making on the vaccine. And one person who I think was very fearful, despite the fact that he's a very intelligent, wise man, was my father. He was a vice president of the BMA, but he had this exaggerated fear that his only last surviving member of his family, which is me, we've had a lot of tragedy in my life. I lost my brother when I was young. I lost my mother a few years before that. And he thought I was going to get COVID and die. So he almost coerced me, actually. And we had lots of arguments. I felt I needed it early on anyway. Let me just see what was going to happen. But he basically, influenced me in a big way to have it, in January. So I had it in December, January 2020, 2021. And then just to summarize quickly the process, I started to observe over the next few months, people who I knew getting some kind of side effect, nothing that seemed obviously serious. Then by the time we get kind of closer to the summer of 2021, it became apparent that it wasn't having this 95 or 100% protection against infection because people were starting to get COVID.
Yep,
but then there was a sudden unexpected death of my father that happened in July 2021. And his post-mortem findings didn't make any sense to me. And then by the end of 2021, data started to emerge, including a whistleblower contacting me from one of Britain's most prestigious institutions, combined with published data showing that the COVID vaccine, mRNA in particular, was causing inflammation of the heart and the heart arteries. And what that meant was it translated to the fact that then the potential was if you have the COVID vaccine, it would accelerate coronary artery disease, blockages in your arteries, which would ultimately mean, for example, that if you were destined with nothing being done, carrying on your normal lifestyle to say how to have a heart attack in 10 years, you're suddenly having a heart attack or a cardiac arrest in 6 months. So once I made that link with my father, because I knew his medical history, I knew his coronary artery calcium score, I knew what was going on, and I could then link it to the COVID vaccine, I decided to do my own investigation. You talk about me being a successful public health advocate on many issues going back years. So, I was the lead person, probably, certainly in the UK and even globally in terms of mainstream media highlighting the benefits of keto diets, low-carb diets. I was a lead campaigner in the UK behind the sugary drinks tax. So I've been in this situation before, and I've always done that from a place where I have published in a medical journal, often high-impact journals, and created news around that. So I thought, this is a very big issue. This is bigger than anything I've come across. I need to look at this myself in detail. I need to go through a peer-reviewed journal to question my own assumptions, okay, and to be more precise with what I'm trying to say. And then I published a paper in the Journal of Metabolic Health. It was then Journal of Insulin Resistance in September, October 2022. The very first person to call me after I went on GB News to discuss it was Robert Kennedy Jr., who thanked me for my courage. And that's how we formed a relationship. And then he interviewed me for his podcast. He knew about my obesity work. And that's how he linked into ultimately, what was planned and obviously didn't materialize, but it is what it is essentially he wanted me to have a very senior role, ideally working with him in HHS in America as a medical advisor, a chief medical advisor. But because the White House and the America and President Trump's policy was America first, and I get that, and I respect and understand that, he came back to me and he was very disappointed, saying, Aseem, essentially the White House is saying no foreigners because I'm a British citizen. So indirectly, the best thing I could do was then, I was appointed as chief medical advisor to Maha Action, which is a grassroots organization in the US that is there to promote, making America healthy again, essentially. It was a moving space. It was an evolving space. I never had a formal role, if you say. I have more of an informal role where I have direct access to President Robert Kennedy Jr., to Jay Bhattacharya, who's a very good friend, director of the NIH. And they obviously knew the issue of the mRNA vaccine was a problem. And of course, Robert has, done a great job in the fact that he has banned any further funding into mRNA technology, certainly for use of vaccines in the United States. So certainly $500 million worth. So that's really where we are.
I have a few questions regarding everything that you shared with us. One is that, I know people actually like very healthy, actually the head of a hospital, the most important hospital, like around 60 years old, died on the street out of a heart attack. He was a healthy guy. He was a doctor himself. I know other young people dying suddenly without understanding why. I know very close people having a stroke. I also started learning in the podcast, the vaccine or the COVID infection itself is causing. So what is the biology? How does it affect the heart and the things around the heart to cause the heart attack?
I mean, in very simple terms, there are probably several mechanisms, unfortunately, not just one. But the most obvious one is that the spike protein, which was considered the most lethal aspect of COVID or severe COVID, was reproduced in the body, having been injected into our arm and spread to several organ tissues. That our own cells were then reproducing spike protein, or it was damaging the cells in every tissue potentially in the body, or causing an autoimmune reaction, the immune system reacting to the spike protein. And studies did come out showing that it was still active in many people for several months. And even a study from Yale a few months ago, which was very concerning, in people who had symptomatic so-called vaccine injury or symptoms of, say, called long COVID. But because of the vaccine, was still having active circulating spike protein, I think 2 years after having the jab or a booster. So that's the most likely mechanism that we know of, Esra. There are two other mechanisms potentially, the mRNA technology itself and also the lipid nanoparticles, the platform in which the mRNA vaccine was used to distribute so-called spike protein to be, act as antigen to generate antibodies to give us some level of immunity. There are different mechanisms, unfortunately. I mean, I've been in conversation with Recep Levi, who you may know is the CDC's head of the ACIP committee, which essentially is in charge of giving guidance on vaccines, all vaccines in the US. And he said to me as well, Aseem, there are lots of unknowns here that need proper scientific investigation of who is vulnerable, what are the long-term harms, what is the mechanism of harm, and then, most importantly, how do we mitigate it? What can we do? Is there a pharmacotherapy? Is there a supplement? Is there a lifestyle change? Is there something we can do? Is it about getting your vitamin D levels up? Is it taking, augmented NAC? There's lots of unknowns, Ezra, unfortunately, because one of the reasons we're not getting there more quickly is there has been a deliberate suppression by government bodies around the world, fueled by pharma, fueled by ideology, fueled by groupthink, fueled by willful blindness, fueled by fear, to highlight just how bad this situation is. And to put it in perspective, me looking at this data independently on the best available evidence, I have never seen such a horrific medical product in my life that has ongoing catastrophic harms. And there are people walking around who I'm fearful of. There are many people walking around who don't know it, that they are ticking bombs for potentially cancer and heart attacks.
When I did a podcast with Robin Rose, when she shared that, when they did an autopsy of deceased Alzheimer's patient, half of them, 50%, had spike protein in their brain that they couldn't clean up, so their Alzheimer's probably progressed very fast. I also heard that within the 2 years of the pandemic, Parkinson's disease, 50% again rised. I do know myself, they tested spike proteins in me, and I heard that, I have in my gut, and it keeps multiplying. So it's kind of like a weird alien getting into our system and then keeps doing whatever it does. Is there any, like you were sharing that, people are looking, scientists are looking the way to mitigate the problem. So do you know anything that we can do to get rid of these, or it's just like going to be floating around?
I think because what we have observed and I've seen in patients is it essentially causes, a form of chronic inflammation. And already in the population, there is an issue of insulin resistance, right? So this is essentially conditions related to excess body fat, right? Including heart disease and cancer and Alzheimer's. So one obvious thing to do, Esra, is one needs to optimize everything you can control in terms of your lifestyle factors. That means diet, that means moderate activity, it means getting stress levels down. Because all of these contribute, right? You just see this as an extra contributory factor. So it makes sense to optimize everything else to reduce the risk of this problem. And then, and that also includes making sure vitamin D levels are in good range. You're on vitamin D supplements, or you're getting lots of sunshine exposure. The other aspect is, in this space, speaking to various doctors and scientists who are working on patients with vaccine injury and trying different methods, there is a supplement called augmented NAC, which is a very potent antioxidant, where those manufacturers claim that they have done their own research showing that through the urine, that they are getting rid of spike protein. It seems to denature it. And some people have noticed a significant benefit from it. So that could be, and it's very safe. So that could be something people use. But the honest answer is we don't fully know. But I would recommend, certainly with my patients I see, I get them on a better lifestyle. They seem to get a lot better. But it also has to be it has to be tailored for individuals depending how severe their symptoms are. And unfortunately, a lot of these so-called technologies that we're using are not cheap, right? Hyperbaric oxygen has been used for long COVID, but it also can be used for people who've got fatigue from COVID vaccine, for example, with benefits, but it's not cheap, right? I mean, certainly in London, if you go in a hyperbaric machine for an hour, and we recommend people have it several times a week, it's costing 150 to 200 pounds. So that's why we really need more important than anything else. We need to do what we can, but there needs to be a greater amount of pressure put on government bodies, on medical bodies to say, listen, we think this is a big problem here. We think you're willfully ignoring it because of fear, because of, all the things I mentioned before. But the problem isn't going to go away. It's only going to get worse. So we have to acknowledge there was a problem. And there was a terrible mistake made. There are people out there, and there are different groups, as I'm sure you've observed it, that think that there was some kind of plan or conspiracy. Now, conspiracies sometimes come true. I'm not denying that at all. But for me personally, having interacted with people at the highest levels of government, politicians, medical doctors, etc., when I've had conversations with them in the past over various issues, whether it was sugar, low-carb diets, etc., statin prescription, it is basically mainly ignorance. And they think they believe they are doing the right thing because the information they're receiving, like everybody else, is a lot of it is actually just coming from mainstream media. Rochelle Walensky, former director of the CDC, she said in an interview after she left that her optimism from the COVID vaccine benefits came from CNN news report. And CNN news report was almost a verbatim reproduction of Pfizer's own press release. So we shouldn't underestimate the power of the media and then it becomes a kind of circular reinforcement that there was such an indoctrination, as you see, that people became so fearful and then believed the so-called science, which is more of an ideology than it's not certainly medicine. It's not an exact science. There were so many problems that was exploiting people's beliefs and indoctrinations in medical science that then led to where we got to. So we have to wind back from those harms. And it can only happen with of course, people need to be held accountable if they acted unethically, and they need to be aware of it. But there needs to be a greater amount of understanding and compassion so that those people who are still indoctrinated are able to understand and listen. And once they listen and you get through the psychological barriers, then you bring them more likely to bring them on side, and you shift the needle, and then some things happen. I think pointing fingers and talking conspiracy and all this kind of stuff from minority groups of people, and they're entitled to have their view. If you look at it doesn't have an impact. It doesn't change anything. It just makes people more angry, and it forms echo chambers. So we just have to think a bit more carefully about, if we care about our fellow human beings. And it was interesting on this. There's a great book written by a friend of mine called Matthias Desmet. Okay. It's called The Psychology of Totalitarianism. And he talks about historically human beings being vulnerable to this so-called mass hypnosis. And in that vulnerability, they lose their ethical self-awareness and ability to think critically. Okay. But what happens in totalitarian state, okay, and this psychological influence is that people will sacrifice their own individual self-interest for the collective, excessively. They will not tolerate any dissent from people who are going against that particular narrative, and they are vulnerable to pseudoscience and propaganda. And when you break down populations, he's estimated this from other research, about 30% of people are completely committed to the narrative. They're completely indoctrinated. They believe 100% in what they're doing. They believe they are right. They believe they are doing good. 50 to 60% will be slightly skeptical, but still go on along with what they're told by the government. And about 10 to 20% are like, pardon my language, this is bullshit. There's something not right here. And of course, we need people like that, and that group needs to grow. But, Ezra, it's not a universal phenomenon in the same people. So one person that can be vulnerable to indoctrination may actually be in the 10 to 20% group in a different situation, or vice versa. So I've seen people, for example, who never got the COVID vaccine. They thought something was wrong, didn't trust what they were being told, but are completely indoctrinated to taking weight loss jabs and then getting side effects and being hospitalized. So we all have to have some humility here, that just because your instincts were right on one particular issue doesn't mean that universally you know everything about every other topic, and you can be equally vulnerable to something else. That's really important for people to understand. There needs to be some humility amongst everybody. And also, there was no correlation with intelligence. So the most intelligent people weren't necessarily the people that were, understanding the situation and not taking the COVID vaccine, and vice versa. Some of the least intelligent people, by normal metrics of measurement, were skeptical because they're marginalized members of society. Different reasons why people didn't take the COVID vaccine. So I think we just have to understand the psychology better. But the way forward is basically standing up for ethics. What I advocate for is that even in the whole system, it isn't just the COVID vaccine. This is a symptom of a failed system where we've become more materialistic, we've more selfish, less connection with each other, less driven by giving back to the community, less empathy. And this is why the populations, in my view, around the world, why we are deteriorating mentally, because we are moving away from what it actually means to be human being, a good human being. That's it. So all of us, to shift the dial, have to think, how can we be the best version of ourselves so that we are able to interact and connect with each other and have empathy for each other and learn from each other. And then we will reach a higher state of being in ourselves, but also the population will then shift to greater good for the maximum number of people.
Everything you say is so wonderful. I see also populations as well as doctors, they're like holding sides, and for some weird reason, they're trying to hold on to what they think it's right. I think it was the same thing about hormone replacement therapy. There's a bunch of doctors that are still sticking to that research study and not giving hormones to their patients while women are suffering. Same here with, I'm going to pass to statin next, but same here with the vaccine. I still know that, very high level doctors from Harvard, Yale, whatever, just because they have these titles behind them, people trust them and believe into them. People who doesn't really question the medical field, they still continue having some sort of vaccine? Because I know very closely that very prominent families here in Turkey, they have a wait that, some vaccines are still coming in because they're convinced that they're old and they need to have continuously having these vaccines. So it's just like I feel it is my job to bring you and people like you to my podcast for people to really hear it, listen to it, not so like, I see that you're not sticking to one truth. You say like we all have to be humble and open-minded to see the change, help people to change.
Yeah, Ezra, in fact, on that note as well, there is a group of people who thinks there was no pandemic, and I can get that in the sense that it was grossly exaggerated. But yes, I have managed and seen people who didn't get vaccinated, right? I'm not saying they should have, because I don't think anybody should have been injected with this product. That's my view. I've been very vocal about that. But have suffered very, very badly. And there are friends of mine and my patients who I know very well, I've got to know very well, from long COVID, like horrifically bad. And there are groups saying, oh, there was no COVID and blah, blah. I was like, and these people are not clinicians, a lot of these people. They don't see patients, so they don't have that. This is, again, related to our experiences and what we see. And they're not willing to listen. There's no humility there. I've seen patients, I'm talking about people, I'm talking about their conditions, what's going on. And I know it was linked to obesity in some ways, etc. And they're just not willing to listen. The most likely diagnosis we know now, and this may evolve or change, that this was a lab leak from Wuhan Institute of Virology. Whether it was deliberately spread or whether it was accidental, I think more likely accidental. And then it's then played out. And it was a new novel type of virus, which has behaved very differently to other viruses we were aware of. So, it doesn't help. We've lost our ability to think in a form of nuance. Like, it's very primitive thinking. It's emotional thinking to say things in black and white. Things are never black and white, very rarely black and white. There is a nuance here. And the nuance gets us closer to the truth. And then when we get closer to the truth by listening to all sides, and everybody should be involved, there should be no censorship of anyone. There shouldn't be censorship of people saying it's a conspiracy. No, let's have a conversation. Let's get to a greater truth, right? Then that's how we get progress. And then also the importance of free speech here is, if they feel afraid to authentically express themselves and speak the truth, then we have less trust of each other. And as societies, if we are to move forward and progress with minimal conflict, people need to be able to trust each other. So this is, again, not good for our mind, because what it means is we're in a constant state of fear and chronic anxiety. We feel individually threatened because we don't trust the next person. And that, and even on a level, everybody can relate to this. If you think about your own families and your own partners and relationships, when you are with somebody, even one person, where you have an authentic expression of love for that person and they have that authentic expression of love for you back, and you have a good quality intimate relationship, you feel better, you live longer, you're healthier, you're less stressed. We have to expand that thinking to broader sections of society too. We don't live in cocoons, we're all interconnected as well. We just have to think a little bit more carefully about, the food. We're all dependent on each other, Esra. The people that make our food, the people that deliver the food to the grocery store, the people that work in the grocery store, the Uber driver, the people that make the clothes that we wear. We should think in a way that we want all of those people to be the best version of themselves in terms of mental, physical, social well-being, because it ultimately indirectly affects us anyway. It's not even a question of, it's actually almost, you can look at it even from a self-preservation perspective.
Since you're talking about feelings and trust and so on and so forth, I have a feeling-focused question, because when I did my podcast with Sabine Hazan, she explained like how many research studies actually she did for the FDA. She was so well-trusted doctor through the governments. When she had this formula that was helping people who had COVID, like basic like vitamin C and D and ivermectin and so on and so forth, how her studies was like retracted and shut down and so on and so forth. And she was feeling really ambivalent and probably sad and surprised and so on and so forth. As well as you're a very prominent cardiologist in England. You had studies, you had papers, you had a book and so on. How did it make you feel that when you say like there's something wrong here and nobody cared, and even you got criticized, you got pushed out of the system and so on?
Well, first of all, I think there's been significant progress, Ezra. And me and many other courageous people around the world have been pushing this message. And A lot of it is actually because of alt media, because the mainstream media hasn't been, we've had some mainstream media hits. That's been my main kind of focus. Is alt media was always there for me. But my thing was, if we hit the mainstream media, we really penetrate through to people who are indoctrinated, or at least slightly skeptical. And my philosophy really is inspired by the likes of Mahatma Gandhi, Martin Luther King, Nelson Mandela, is that most people are genuinely, I think, intrinsically good. There is a good heart in Buddhist philosophy, and I'm very much Buddhist in terms of my thinking. I have the belief that there is a good heart in every individual, which is often buried beneath a rubble of confusion and fear and ignorance. So I go with that mindset. And I also appreciate that most human beings, we want the truth. We always want the greatest truth. We want to know the truth, and we hate injustice. So what did Gandhi say? You make the injustice visible. That's how he managed to get the Brits out of, India, for example, to show that the injustice that they were inflicting by oppressing Indians. So with that mindset, for me, there's also something else that you recognize and understand as an advocate is that, and this actually is from the Lessons of Public Health Advocacy that comes from a paper written by Simon Chapman, who was an Australian psychologist that became Australia's most vocal advocate, taking on the big tobacco, right, for 38 years. For many, many years, the tobacco industry, a lot of people won't know this, right? They suppressed data on cigarettes being harmful, causing heart attacks, causing lung cancer. But they had a particular strategy of planting doubt, confusing the public, denying it, that cigarettes cause lung cancer, and even buying the loyalty of scientists. One of the rules that comes across, or from Simon Chapman, also linked to Gandhi's philosophy and advocacy, is as soon as your work threatens an industry or an ideology, an ideological cabal, you will be attacked, sometimes unrelentingly and viciously. So you have to grow our rhinoceros side. You have to have a thick skin. Now, it's not always easy. We're human beings. But for me, I took a lot of those attacks, and I've been attacked everywhere, right? Mainstream media, even alt media. In fact, there's somebody I won't name, but there is apparently a German doctor who basically gave an interview on, I think, one of the German alt media channels recently. I was informed. I don't know who this guy, I'm not going to name him because I don't know who he is. But I get it from both sides. And this doctor basically has done an interview where he's saying Aseem Malhotra and Robert Malone are controlled opposition. So we are secretly working for the pharmaceutical industry, for example, and we are there to try and pacify the public from getting too angry. And listen, I'm not judging him. He can have his opinion. I'm trying to understand why he thinks that. And I think there are people that think that because, one, they have got black and white thinking. They already made their mind up. There's no humanity. It's a conspiracy theory. And anyone who is speaking calmly or who's getting some platform, right? By the way, Ezra, it is not easy to break the mainstream media. I am successful maybe 1 out of 10 times for everything I do when I'm throwing every resource I've got to try and break through to somebody, one journalist, one opportunity to speak. It is absolutely like what you see in terms of me being out there is the tip of the iceberg of the work I've been doing behind the scenes to change things. And it can be done. And in my view, the reason I get that opportunity, or at least some opportunity, or have had that opportunity, is one, my track record and my reputation of being a very ethical doctor, a public health advocate, but also because I'm not speaking from a place of anger. Although, listen, don't get me wrong, I've had moments of very extreme anger. Listen, I've lost all my family are dead. All my immediate family are dead. I live alone. Friends estranged from me. The last surviving my member, who I loved very dearly of my family, was my father, my best friend. I know and feel that, yes, he was essentially killed by a system, although I could divert it to one particular individual if I want to say it's the head of Pfizer, but I try not to do that. I should be as angry, more angry than anybody else in this space. Okay, I've gone through depression. But I also think carefully about this because I'm an empathetic person, because I'm a rational person, that if I am to play my role to help others as much as possible and share my knowledge, the way to do that is through a level of humility, through a level of understanding the psychology of human beings, not to get up there and start screaming and shouting and saying, hang these people, murderers. It doesn't work. And what it does is actually, for the people who are indoctrinated, Ezra, they double down. It makes them justify in their own head that these people are crazy. Mm-hmm. So it's a lose-lose. It's a very self-indulgent way of thinking. And all I'm saying to those people is just think, okay, is the way that we communicate, first of all, question your own beliefs about what's going on. Am I absolutely sure that I'm right here? There was a conspiracy. Am I completely sure? And if I am, please give me that evidence. And even if there was a conspiracy, which I don't think there was, who was involved in it? Who was involved in it? Can't be everybody, right? And if it was a small group of people, if everybody else is just indoctrinated, how do I at least communicate with the people who are indoctrinated to make them understand and listen to me, who are not going to respond straight away saying, oh my God, yes, there's a conspiracy. So, we just have to think a little bit more about how to go about these conversations. But yes, Ezra, for me, I think it's frustrating that I'm attacked from all sides. And it is what it is. You make a stand, you're out there publicly. You can't please everybody all the time as well. So I just carry on with what I think is best and right. And hopefully, ultimately, I've had people come to me, by the way, Ezra, who are very tearful and sad and kind of come up to me and say, Aseem, I'm so sorry. I was completely wrong about you. In fact, one person here who I'm in Cyprus, he said he didn't take the vaccine. In fact, didn't take the vaccine because he was young and fit. In fact, before I even realized it was a problem, and he said because of your recommendation, but he said, why is Aseem being so diplomatic? He was upset. And then he's watched how things have evolved. He said, oh my God, your approach was absolutely right. I'm so sorry. I thought that I was upset with you because I thought you should be more angry and pointing fingers and saying, jail these people and blah, blah. That just tells you that we can all move forward constructively here. If we surrender our ego, okay? A lot of these people, if they think carefully about the way they're behaving, is because they are speaking from a place of ego, not from a place of empathy, not from a place of being the best possible human they can be.
Thank you for the explanation. Can we now jump into the cholesterol myth? Because, at least vaccine and COVID issues lasted only for a few years, but this cholesterol myth and the statin is like a long-lived journey for many people. As I mentioned at the beginning of the podcast, I'm a very healthy human being. And
first of all, Ezra, can I say one quick thing? Sorry. I'm very, very sorry that you suffered vaccine injury.
Yeah, thank you.
I'm also vaccine injured myself. I've got a flare-up of an autoimmune condition, psoriasis. Sabine Hazan, who I think is a brilliant woman, she diagnosed that I had lost, as you're probably aware, in the microbiome, there's a very important bacteria called bifida. And that had gone to zero. So Aseem, you are somebody who has been, most vocal advocate for a healthy diet, out there. You follow your own advice. I'm obsessed with my own health. You've got, you should have an abundance of bifida. And then, of course, she showed through her own research that over 2 to 3 years that through whatever mechanism, the COVID mRNA vaccine, and some people with severe COVID, the bifida was going to zero. And that was triggering all sorts of, and I had depression, autoimmune, whatever. I know there are other reasons for that. So, I'm also in the boat. I'm a vaccine injured doctor that's also trying to fight everything and heal myself. And partly through healing myself, if anything works for me and I think it has the legitimacy, I share that with my patients.
Yeah, I'm going to be seeing her in 2 weeks in Los Angeles. Let's go back to this cholesterol myth. So I was sharing with you that I'm 54 years old. I'm, super healthy. My LDL cholesterol was kind of high in the 220. And I have great doctors that takes care of me from the United States. And I was going to have a surgery, so I had to do some effort test and so on and so forth. I saw a cardiologist here in Turkey in a great hospital. The minute he saw the markers, without asking nothing like how I live, what I eat, what's the little A, little B, whatever, he goes like, oh, you need to be on statin. Another cardiologist from New York, NYU, very, very prominent, doing like heart transplant surgery guy, looking to the cholesterol level, says like, you need to be on statin. And, obviously I'm not. Yet, so many also podcasts that I did, I heard from different type of doctors, like from OBGYN to regenerative medicine to esthetician, whatever. Everybody says the downside of statin because they experience for men, lack of sexual health, for women, whatever, so many downsides. So what's up with this cholesterol myth? Why majority of cardiologists trying to push it down the level? And I know that, in the new era of health, the way that you guys look at it is different. Can you explain this a little bit, please?
Yeah, so again, this is a partly an indoctrination to understand why certain cardiologists and doctors still push this issue. Again, it's financially based medicine, if you like. It's a very profitable. Well, statins are off patent now, but it's still, the cholesterol lowering industry is $1 trillion industry at least. So there's a lot of money to be made, and there are new cholesterol lowering drugs other than statins that have come on the market. The mindset and the belief system. Okay. Remember, medicine is not an exact science. Everybody, if anyone comes away from this podcast, the most important message from them, they should understand, is medicine is not an exact science, not even close, not like physics or chemistry. The father of the evidence-based medicine movement, David Sackett, said 50% of what you learn in medical school will turn out to be either outdated or dead wrong within 5 years of your graduation. The trouble is nobody can tell you which half. So you have to learn on your own. So a historical mindset on cholesterol is that even the lower the cholesterol, the better. The high cholesterol is the most important risk factor for heart disease. And, to quote a eminent cardiologist in the US who wrote in a medical journal in 2011, in a paper titled, "It's the Cholesterol Stupid," he said, you can be an obese, diabetic, sedentary smoker, and as long as your cholesterol is low enough, you'll never develop heart disease. It sounds crazy, right, Ezra? Doesn't it sound insane?
Yeah, very, very crazy.
But this is written by an editor of a journal in one of the most prestigious medical journals. So think about that. So that is an indoctrination. That is like a religion. What do the facts tell us? I can only tell you my perspective from my own independent analysis over 10, 15 years on cholesterol. And I've written about this. People want to get a copy of my book, A Statin-Free Life. I go into it in a bit more detail. But there are a number of factors. One is, for the majority of people, even traditional studies, high total cholesterol, LDL, did not predict whether or not you're going to get heart disease or not. Okay. It was only a predictive factor, really, in very extreme cases, in people with a condition called familial hyperlipidemia, where they have genetically, most cholesterol is genetic anyway. You can alter it a little bit, but it's genetic in terms of LDL and total cholesterol. Those people got premature heart disease, and people who have, their LDLs of 250, 300 plus, okay? Or at least 190 plus to start with. And then, people who had genetically very low cholesterol, Ezra, say less than 150 total cholesterol, all right? They didn't tend to develop heart disease, but they didn't live any longer. They would die of other things like cancer, for example, all right? So they thought, because we've got these extreme values, it must be that if we lower it with a drug, it will prevent heart disease. And the initial trials on cholesterol-lowering drugs before statins were discovered didn't show any benefit. The randomized trials, when they followed people up, they didn't show any benefit in preventing heart attacks. The cholesterol was lowered, but didn't prevent heart attacks. But the scientists were like, hold on, let's keep trying, okay? This can't be correct, or we need to lower it more. Then statins started showing that benefit, which I talk about, 1 in 100, 1 in 39 if you've had a heart attack. And they thought, damn, we've completed, it's all complete now. The theory is perfect, done. That's it. But a number of things weren't discussed, right? Even if you genetically have a condition that tells you you're not going to develop a disease, it doesn't mean that is necessarily the reason why. It could be something else that isn't identified that is the main reason you haven't developed heart disease. So genetically low cholesterol could be that they had also perfect metabolic health, right? And vice versa. So I've done a lot of extensive studies on this, and we're looking at people with familial hyperlipidemia. I did an independent analysis published in BMJ Evidence-Based Medicine 2021 with 2 other cardiologists, peer-reviewed, and we found, looking at 35 randomized controlled trials, including statins, including new injectable cholesterol-lowering drugs, that we asked whether this question was true. As you lower the cholesterol in people at low risk of heart disease, high risk, okay, in the drug company's own trials, which are selected, by the way, to try and give an answer that they want, there was no clear correlation. So lowering total cholesterol LDL, in my view, is a waste of time. It is not beneficial. And what we do know is that if people have optimal metabolic health, insulin resistance being the most prominent driver of heart disease, then their risk is most likely to be lowered. And that's through looking at triglycerides and HDL. So within your cholesterol profile, if your triglycerides and HDL are normal, you can almost certainly completely exclude your LDL being high as a problem. So this is my approach to it. And then, of course, you calculate someone's risk, and then you have an informed discussion about what the pill will do for them. And that's the way we should move forward. So I think it's a very misguided approach. And I think it's also failed, Ezra. It's failed. So we've looked at population studies over in Europe, for example, published in the BMJ, did increase prescription of statins to millions more people, reduce death rates from heart disease, and there was no reduction. And part of the reason for that is that the actual benefit of a statin, you look at groups from randomized trials, looking at increase in life expectancy, even people with high risk of heart disease, over a 5-year period, I said this to Joe Rogan, is just over 4 days, is the median increase in life expectancy. So it's a very marginally beneficial drug. And people need to understand that small benefit. And if they want to take the statin, great, go for it. But it shouldn't distract from other things, such as lifestyle changes, which is often what happens.
So what are the downsides of taking statin? Because I don't know exact details, but it seems like there's it kind of deplete your coenzyme levels.
Yeah, it reduces, in simple terms for people listening, it causes fatigue, interfering with mitochondrial function. It's established now that in 1 in 100 to 1 in 50 people, it will cause type 2 diabetes. It can cause issues with, cognitive function a little bit. People can have brain fog, stomach upset. You mentioned sexual dysfunction earlier. These are the most common, muscle pain. These are the most common side effects. And in my view, probably, I would say at least 20% of people will experience some kind of side effect if they're taking statins for a long period of time. But the good news is, Ezra, it's fully reversible in 99.9% of cases. So within a few weeks of stopping the statin or reducing the dose, these symptoms improve. And that's what you can always do that as a trial. I'm not telling patients to do that because you have to talk to your doctor to see what's right for you. But in my experience with patients, this is what I tend to do.
What's the percentage of diet being effective on the cholesterol? Let's say, I'm not talking about junk food, obviously, but let's say someone healthy and, give or take eating healthy, is diet directly correlated with the cholesterol levels?
Yes. In terms of improving the cholesterol profile, the most effective way to improve your triglycerides and HDL, which are the most important drivers of heart disease, is going on a low-carb diet. So eliminating all sugar and starch. So no bread, no pasta, no rice, no potatoes, no sugar, no fruit juice, no honey. You can have low sugar fruits only. If you do that for 6 weeks and repeat your fasting cholesterol profile, you'll probably see a big improvement. It also, by the way, the same diet also lowers blood pressure and can also send type 2 diabetes into remission or reverse type 2 diabetes.
What's looking your horizon? What are your goals now? What type of changes you're aiming to help them make the MAHA and MEHA movement?
Well, listen, I think it's a global movement. So, this is one mechanism. MAHA is one mechanism. It's great. I'm so proud and of my friend Robert Kennedy Jr. of what he's doing, and other people involved in MAHA that are very vocal. I think that, we can all have a role to play. I think we shouldn't just be dependent on one particular movement. I think it's good it's happening. And it can lead in many ways, but everybody should be collectively trying to advocate for better health for all people. For me, there are different mechanisms of getting that information out. Some of it are podcasts like these. My greatest strength or my skill where I started off is my writing. So it may be that I write more things. It might be I write another book. I'm thinking about that soon. And of course, I made a documentary film called First Do No Farm, which was heavily censored in the mainstream, but it became the highest rated health documentary in history on IMDb. 9.5 stars out of 10. First Do No Farm. You can download it on a website called nofarmfilm.com, NOPHARM film.com. But Ezra, what we want to do is then turn that into something which becomes, a Hollywood documentary. And at the moment, if there are people listening that are interested in investing, we're looking for investors. We need probably between $1 and $3 million to get maximize the impact and do an Oscar campaign for this next part of the story to film that. So that's something else that we're also thinking of. So that's really what I've got in mind, as well as trying to heal myself. Yeah, that's it. I will carry on, obviously, pushing the message in whatever mechanisms I can do that, whether it's lectures, whether it's podcasts, whether it's books. That's my plan.
Aseem, thank you so much for this wonderful podcast. I was really, really eager to have this because I totally believe everything you say, and I try to spread the same message to people around me. Like you said, though, to be healthy, it's not like being obsessed about I did this or I didn't do that, but yet, improving their health so that all these negative things that we're going to keep facing. We're human beings, and there are going to be some people, again, there's going to be a medication or another vaccine or another, idea that this is great for your health. People need to be really conscious of what they're doing and do their own research before doing it. I think that's the most important thing. I heard a talk of Eric Verdon, the president of Buck Institute, and he says that, doctors now needs to be much more careful when they deal with their patients, because there's lots of great podcasts, there's the AI, they do their own investigation, so they're not going to just come and listen to us, we telling them, do this.
The only thing I would say, though, about the do the own research, Ezra, is there are people who have, some people, choices are not equally distributed. Some people have more resources and agency to make those decisions. So it's our job also to help guide and look after those people that don't necessarily get the best guidance, who are just going to be blind and trustworthy of the information they're given from the mainstream. So that's why also we can't just leave it to individuals alone. We have to help other people.
So thank you for your time. I know your time was limited. Thank you for this podcast.
Thank you. Thank you, Ezra.